You're listening to the 123 show with me, Noreen Mir, this Thursday afternoon. Let's turn to our first topic and guest of today. In the next 15 minutes or so, we're talking about depression and bipolar disorder. How are these two sort of often confused because they share some similarities and also some major differences. And I'm delighted to be joined by Dr. Eslyn Terragina, a chartered psychotherapist and psychologist with Mind Balance Hong Kong. Welcome back on the program, Eslyn. It's great to chat with you again. How are you doing?
I'm good, thanks. Thanks for having me back, Noreen. Great to be here.
Yes, it's great. Now, this afternoon, you're going to talk through sort of the similarities and sort of the major differences, because sometimes bipolar disorder is sort of easily confused with depression because it can sort of include these depressive episodes. Maybe if you can give us an outline of the similarities and also the differences between the two.
You've got depression is part of bipolar. So depression is we're looking at symptoms like depressed mood, diminished interest and pleasure in things that we used to like doing, but also things like there might be change in appetite or sleeping habits, and a slowing down of our thoughts, maybe our movement, and fatigue, general fatigue. And then we've also, what I see in a lot of clients with depression, this overwhelming sense of guilt or worthlessness. Now, like you might notice, I haven't even mentioned the words suicide yet, right? So a lot of people associate depression with, oh, you're suicidal, you either think about suicide or death or think the world's a better place without you. But actually, and it's obviously related, but actually it's one of the symptoms. So you can be depressed without having suicidal thoughts. And you can also have suicidal thoughts without being depressed. Now, with bipolar, you have these depressive episodes where you experience some of the symptoms I've just spoken about, but that's part of it. The other half of the bi is manic episodes, so actually very much the opposite, very, elevated mood, restlessness, sort of an irritability. You might be feeling like there's a burst of energy and you'd be talking really quickly, or some racing thoughts. You may be sleeping less. And I think one of the key things of mania that I would say is people often have an inflated sense of self-esteem or an inflated sense of ownability. So people engage in more risk-seeking behaviors, be that going on a big shopping spree or, going on a drug binge, a lot of risk-seeking or gambling, very risk-seeking behaviors. So it can actually be quite dangerous, even though people sometimes feel that in that manic time, because they need less sleep and they're so active, they get more done.
Wow. So
yeah,
actually,
so that's,
we see a lot of, we hear a lot of creative types. I mean, now people call it bipolar disorder, but back in the day, it used to be called sort of manic depression. And they have those sort of, as you mentioned, manic episodes, where they, maybe they don't sleep a lot and they can get more done. And we see that a lot in creative types sometimes. I've also read that there's bipolar 1 disorder and bipolar 2 disorder. What's the differences between those two?
So bipolar 1 is what I'm describing now with the mania, and bipolar 2. Bipolar 1 is more commonly diagnosed and what we more commonly associate with manic depression. Bipolar 2, some of the symptoms will be considered less severe. It's the first time you're having a manic episode, and it might not quite meet the criteria of bipolar 1, which is the one with the symptoms of mania that go on for at least a week, and there's a certain set of symptoms and a certain number of symptoms that you need to qualify for that diagnosis. Whereas bipolar 2, if you so will, there's lower criteria to qualify for bipolar 2, and it's usually if you've maybe had depressive episodes in the past, but this is your first episode of mania.
Okay. And how long do these cycles typically last for, but between shifting between mania and depression?
So, I mean, that can be very, very different. In terms of diagnosis, so with depression, we would diagnose it if a certain set of symptoms had been present on a daily basis for at least 2 weeks. With mania, it's for the kind of elevated mood, the high energy levels, that would be diagnosed if certain symptoms are met for at least 1 week.
Oh, okay. So with these cycles, I mean, do people, I've heard of people who have bipolar disorder. Sometimes they don't want to get out of bed and they sleep through it. And that can last till about 2 weeks. And then afterwards they get this sudden burst of energy. Is that quite common then for people with bipolar disorder to suddenly be out of that depressive mood and suddenly get that burst of energy?
Well, yeah, that's pretty much exactly how it can work. Yes, when you're describing the 2 weeks of sleeping it off, sort of that's actually what we would consider a depressive episode, right? The not being able to leave your room or not being able to even leave the bed, possibly starting to neglect your own self-care a little bit, not eating, not taking showers and things like that. So that would be the depressive part, and yes, that can swing into the manic part.
Okay. But I mean, can they be medicated are they usually medicated, or how does it work for the treatment then?
So with depression, I get with mania, quite often it's medicated, yes, because it's such a high alert state. The system is so overtaxed that often the chemical imbalance in the brain has to be medicated. Or anyway, that's a treatment of choice, right? But with depression, that can have a wider range of treatments. So, things like cognitive behavior therapy, so helping to break negative thought patterns. Also behavioral activation, because quite often, once we're in a depressive state.
Sorry, what's behavioral activation? Sorry.
Yeah, well, quite often when we're in a depressive state, it's quite difficult for us to even get little things done. And then it becomes a bit of a vicious cycle, right? Because we're looking at all these things that we should be doing, and then we start beating ourselves up that we couldn't even do the dishes or take the trash out. And so behavioral activation is a part of cognitive behavioral therapy where those little step-by-step behaviors are stimulated so that, rather than being overwhelmed with all the chores we have and all the tasks we have, we focus on certain priorities and slowly, step by step, getting ourselves activated towards those. So that can be great in lots of ways. It gives a bit more routine, which is really important for humans in general and for well-being, but also it helps to, take away that secondary guilt and that secondary stress about neglecting the things that we need to do or not getting anything done or feeling unproductive.
Yeah.
But just to finish off with the treatment, I just wanted to quickly add, talking treatment and psychotherapy can be really effective for depressive episodes, because often depression comes from much more of a core issue, right? So while we can also work with distress tolerance and also mindfulness, so non-judgmental awareness of the moment, acceptance and grounding, it's also really valuable to look at, well, why does this depression come? Why does it keep coming back? It's often linked to previous trauma or previous times, even up to into childhood, where our needs weren't met, and somehow that has formed certain behavioral patterns and certain emotional patterns. So even though there's also medication, of course, available for severe cases of depression and severe episodes, psychotherapy can be really effective there.
It's also worth noting that when we talk about trauma, it doesn't have to be trauma with a big T. It can be the little T's as well. I mean, it doesn't mean, you necessarily come from a broken home, but it can also mean that if your parents were sort of helicopter parents or too smothering, that can also result in trauma. Is that right?
Absolutely, and also people quite often associate
it on the parents, though.
No, exactly. I was going to say people quite often associate this with the parents, when in actual fact it can be anyone that's considered an authority figure. So that could be a teacher, it could even be a neighbor, an adult that might be intimidating to us as children, can cause small levels of trauma. But of course, there's also then big levels of trauma from neglect, abuse, or even accidents and injuries in childhood.
Yeah. One thing I'm trying to get my head around, Eslin, and that is sort of good mental hygiene. I mean, sleeping, for example, is really important for everybody, but also especially for people with depression, because if you sleep well, then it sort of improves your overall mood. But then if you've got sort of bipolar as well, where you're sort of alert and got a lot of energy, your brain sort of doesn't stop. You can't go to sleep. So how do you how might that affect or trigger more depressive episodes if you're not actually resting or sleeping?
Well, and I think all of us can relate to this a little bit. If we're sleep deprived,
Yes.
then we're often
Yes.
quite emotional, maybe a bit more irritable, and sleep is super, super important. And that's how people get stuck in this cycle. Now, also, I don't. Depression, you might sleep a lot, but you might also have the same problem. You might not be able to sleep very well.
Yes, that's
And so,
true.
of course, the less you sleep and the less sleep you get, the more fatigued you are, the harder it is to battle, right? To try and fight that kind of darkness. And the problem with depression is it feels heavy, right? And it can slow down your thought processes. And people sometimes feel like they're in a fuzz and they can't really get out of it.
Yeah.
And so obviously mania can contribute to making us even more wired, interestingly. So the less we sleep in that manic episode, the more wired we might actually get. And it can go as far as psychosis and hallucinations and things like that. So
Wow.
it is quite a dangerous phase to be in, because people can injure themselves. People can even suicide. A lot of the time people associate depression with suicide, but actually in a manic phase, suicide is also common.
Wow. What about, I mean, with things like depression, I mean, some of the signs we're more familiar with, a fatigue, or people sort of, that they lose interest, and, friends and family, maybe they don't want to hang out as much. But when somebody's got bipolar disorder, it's harder to spot. Maybe they're better at hiding it. So how do we notice some of these signs if they're not displaying the typical sort of being withdrawn from social situations? That, like, they still come out and they're very talkative. They're just quite energetic. How do you distinguish that? How do you know if somebody has that?
Well, very much you'd be looking for changes in their behavior. Right. So if someone's not usually super talkative and suddenly they're talking really quickly and really are really hyped up, look at the context. Obviously, they might just be excited because they got promotion. But if it's ongoing and there's no real, the context doesn't really bring that out, then that's something to look out for. Also, typically in the more advanced stages of that phase, you will notice, because people are very, very restless, they're very hyper focused on something, they're putting so much energy into something. And then, like I say, the risk seeking behavior. So if someone, maybe has a couple of glasses of wine a week and suddenly is like out partying for 3 days straight, binging, that could be a sign that obviously something has changed, something might be wrong, they might be in a manic phase. Now, I really want to highlight that, just because someone's in a manic phase doesn't mean they necessarily go to drugs and alcohol.
Yes.
Could be any risk-seeking behavior. So I don't want that to be assumed from what I just said. But something that I found, in society in general, people use the word bipolar really in the wrong context. So something that I did want to highlight today is that I'll hear someone say, "Oh yeah, my partner's really bipolar," and they mean that someone has mood swings, or they might be triggered easily from normal,
Yes,
like a normal
I've heard
conversation,
that
to
too.
anger and stuff. Yeah,
But that's totally
yeah,
incorrect.
and
Somebody with mood swings doesn't mean they have bipolar disorder. Absolutely not.
that's right. And it also doesn't mean that someone has bipolar traits. I mean, what people are typically describing in that context is that someone might be easily triggered, right? That they might be in a neutral, calm state and suddenly they have anger flare-ups, or sadness or tearfulness, and it's very sudden. So the people around them might not understand why it's come on, but that's usually there's been a real trigger. It's just that the people around the person may not have noticed the trigger, or may just simply not know why the person is so triggered. But it's very different from actually having bipolar disorder, or even having bipolar traits.
Can you sort of cure bipolar disorder then? Is it something that you can manage and cure?
Well, I think the research is a little bit conflicted here. Generally speaking, people speak of bipolar disorder as a lifelong disorder that can be managed but not cured. And typically that theory goes along with medication to manage the manic episodes. Now, I do think that things like psychotherapy can certainly address the depressive part, and can certainly help clear some of the maybe held trauma or held emotions in that. So, in that sense, that can be successful. But there is that chance of that it's a chemical imbalance in the brain, and that these manic episodes may need lifelong management with medication.
Yeah. Is it quite common? Do we see that more commonly these days, or is it just better diagnosis that people are sort of more understanding that that there's bipolar disorder now, and whereas before it was just a blanket, oh, you've got depression, he's got depression, sort of thing. Are people sort of getting better diagnosed with the proper labels?
I mean, it's a little bit tricky to say, because if people, we can't really, we assume that, right? We assume that rather than it being more people have bipolar or are developing bipolar disorders, that we see more accurate diagnoses, right? That's an assumption we make. Yes. We can't say that for sure, of course. Personally, to be honest, I primarily see clients with depression or major depressive disorder, rarely with bipolar disorder. But that's a biased sample. Obviously, that might just be the type of clients that I happen to work with. So yeah, there's definitely, as the DSM-5, so the Diagnostic Statistic Manual that we all rely on as psychologists and also psychiatrists, I believe, that one evolves. So we're up to DSM-5, and every time they add new research in, some of the categories might be changed a little bit, the symptoms might be more specified. So as research develops, the diagnosis develops as well, our manual develops, and therefore things are better diagnosed for sure.
Yeah. Oh, excellent. Eslyn, maybe if you can remind our listeners once again how they can find out more about you and Mind Balance Hong Kong as well.
Sure. So, I do individual and couple psychotherapy and counseling. And you can get hold of me on mind-balance.org. So if you go to that website, then you can find out a little bit more about me and also the type of therapy I work with and what kind of disorders and what kind of just general symptoms as well I work with.
Excellent. Well, thank you so much for your time, Eslyn. And we've been talking to Dr. Eslyn Taragina, who's a chartered psychologist and a psychotherapist with Mind Balance Hong Kong. Thank you very much indeed for your time today. Chat to you soon. Bye for now.
Thanks, Noreen. Bye-bye.